Hello and welcome to another episode of Creating Optimal Health After 40. I'm your host, Dr. Mike Cockrell, and I want to thank you so much for joining me here for today's episode. In this episode, I wanted to go ahead and do a coronavirus update. It's a hot topic right now. Everybody's talking about it, and from a perspective of trying to reduce your risk and decrease the likelihood of spreading this disease, I thought it would be fitting to at least do an update to help educate those of you who are listening to our podcast. So, with that being said, let's do a little update on coronavirus. Before I get into the topic today, if you're not already a member of our private Facebook group, I invite you to join that. We do tons of updates. I share tons of information. You've got access to a lot of educational information on that Facebook group. And in the process of developing an entire membership site that you'll have access to as well as we move forward, that puts all of that information into one nice, concise spot. So if you're not already a member of our group, I invite you to join. You can do that by going to facebook.com/groups/COHA40 and requesting to become a member. So that being said, let's get into seeing what we know about coronavirus. So first and foremost, what is coronavirus? Well, coronavirus is a very common respiratory virus that's been around for eons probably, that is a very common cause of colds and other respiratory infections. Now, the one that we've really been talking about recently is COVID-19. Now, COVID-19 is a particularly new strain of coronavirus, and it's called COVID-19 because it's the World Health Organization designated it COVID-19, which is short for Coronavirus Disease 2019, when it originated in China. So there you go. There are tons of these viruses around. They've been around for a long time, so they're not particularly uncommon to us, but there are some new ones that are spreading a little more rapidly than they have in the past, and that's why there's been such a stir over how this virus is being handled, because it does spread very rapidly through general populations, and it creates a lot of problems economically, physically, health-wise, emotionally. It's going to be a lot of concern, a lot of problems for a lot of us before it's all over and done with. So when we look at how many people currently have the COVID-19 virus, this is information that is changing very rapidly, by the minute kind of stuff. Now, one of the websites that I am using myself is this New York Times coronavirus update page. Here's the link to it, but if you look at this page, let me see if it'll let me click out of here without messing everything up. They are constantly tracking the coronavirus cases in the U.S. In fact, I looked at this first thing this morning, and right after I'd looked at it, it had just updated early this morning at 7 something. I'm looking at it right now. It's already updated again at 3:48 today. And when you look at this, you get a good glimpse of the map and where most of the cases that are either suspected or have been diagnosed are currently at. You can see that a lot of this virus is saturated on the West Coast and in the Upper East Coast as well, but there are hot spots all over the U.S., and I have a feeling over the next couple of weeks this is going to get even more widespread, because we're just now beginning to experience what China experienced about 2 months ago. So there's a lot more of this coming. The other thing about this website is if you can scroll down in here, you can actually click it open and it'll show you state by state where the majority of cases are. And you can see that the majority of deaths right now have happened up in Washington State, 510 cases that have been identified, 37 deaths. I noticed in Mississippi, where I'm broadcasting from, early this morning we had 4. I heard right after they started this morning, we had an update, and now we are identified 6. So this website is updating itself very rapidly and may be a good source of information for you. And it's coming from the New York Times. So I'm going to leave that with you, and we're going to move on and see if we can get back to our presentation. So one of the questions that comes up a lot in the practice, and I hear people talking about, and I've talked about myself, is the flu virus we know kills more people than COVID-19, at least so far. It's actually way more deadly, the influenza virus is, than the coronavirus is. So why are we so worried about COVID-19? Well, part of the problem that we are dealing with is not so much the mortality yet with COVID-19, but just how rapidly it spreads. It seems to spread much easier than influenza, and you may have been infected with the virus for anywhere from 2 to 14 days before you show symptoms. And our suspicion is during that time period when you're asymptomatic but infected, you very likely are able to shed that virus, spread that virus, and therefore you can infect dozens and dozens and dozens of other people before you even know you're sick. So if you do get sick, if you're having any kind of symptoms of upper respiratory infection, flu, especially dry cough, fever, those types of things, as you'll learn as we go through this, go to your doctor and get that checked out because you need to be tested for flu. We're still seeing tons of flu in our area. You need to be tested for other respiratory viruses that may be out there, and you might need to be tested for coronavirus as well. The testing kits are just now sort of becoming available. Prior to this coming week, we've not been able to get access to testing. I've been assured by our particular laboratory that we should be able to get the coronavirus testing done starting sometime next week for people who have suspected symptoms. Prior to that, unless you had traveled into an endemic region or traveled overseas and had a fever, it was very difficult to get a test done through any of the state testing facilities. So, what are the symptoms of COVID-19? Let's talk a little bit about that. Some people infected with the virus have absolutely no symptoms, which is part of the problem because they don't have symptoms, and if they do have symptoms, they're very mild. So those people, if they're not paying attention to their upper respiratory patterns and changes, subtle changes, they may spread the virus to a lot of people before they even know there's anything going on. But when we look at the symptoms, what we do know is the virus tends to cause symptoms like low-grade fever, body aches, coughing, nasal congestion, runny nose, sore throat. In fact, one of the primary things that may emerge first is it seems to attack the nasopharynx, so you may have a sore throat before you have some of the other symptoms. However, COVID-19 can occasionally cause really severe symptoms like a very high fever, severe cough, shortness of breath. That's possibly due to a pneumonitis or a pneumonia type picture that emerges from the virus being in your system. So the next question is, how long is it between when a person is exposed to the virus and when they start showing symptoms? And we alluded to this earlier, but that's one of the big problems we have. Anywhere from day 2 of exposure to about day 14, you may start having symptoms. So there's a very long period in there when you could actually be infected with the virus and not actually have severe symptoms, but you could be spreading the virus to other people that you're coming in contact with. How does the virus spread? Very simply, it's thought that it spreads mainly from person to person through respiratory droplets, and that virus being aerosolized into respiratory mucus and that kind of thing as you cough or sneeze or spread it around from that type. The droplets that are produced when you cough or sneeze can be spread. The virus, we're not sure how long it lasts in the atmosphere right now. It may die quickly. It may last for longer periods of time. There's a lot of uncertainty, so that's why everybody is really pushing to get things under control as quick as possible, because we really don't have a good idea of just how long some of this stuff is going to be and exactly what we're looking at yet. The next one is who is at highest risk for getting sick. And just as in a lot of the respiratory viruses, people that are elderly seem to be at the highest risk. The people with immunocompromised immune systems, people who are having chronic medical issues, especially chronic bronchitis, emphysema, heart disease, diabetes, those types of people are at higher risk. Now, the virus itself doesn't seem to be very severe in young children, which is a little bit different than it is from some of the other respiratory viruses, especially a respiratory syncytial virus and influenza. Those tend to affect the really young and the really old. This one really seems to be targeted more toward the elderly than toward the younger populations. So, are kids immune to the virus? We don't really know. We do know that the children seem to experience milder symptoms than older people. Whether or not they're immune to it, no one knows for sure right now, but just assume that everybody has the potential to get infected with this. It's just that some people are going to be hit harder with it than others are. Will warm weather stop the outbreak? There really isn't any evidence out there so far that seems to show that the weather getting warmer is necessarily going to alter the virus. We do know, especially with influenza and those types of viruses, as the weather warms up, the viruses are still there, but we tend to be a little less susceptible to them. So we're hoping the same thing happens with COVID-19, but right now no one is certain, and so we are taking all the precautions we can just to keep this thing from spreading any faster than it's probably going to spread on its own. So let's talk about some things you can do to protect yourself. So what do you do to try to protect yourself from COVID-19? First and foremost, the following actions really seem to help prevent the spread of COVID-19, as well as other coronaviruses, RSV, and influenza. So, avoid close contact with people who are sick. Avoid touching your eyes, nose, mouth. Stay home when you're sick. Cover your cough or sneeze with a tissue, or sneeze and cough into your elbow, and then if you're using a tissue, throw that tissue in the trash and immediately wash your hands. Clean and disinfect frequently touched objects and surfaces using regular household cleaning sprays or wipes. Wash your hands often with soap and water. You can use some alcohol-based disinfectants as well. Just need to be aware that the alcohol-based disinfectants sometimes take longer to work than soap and water. So just make sure you're taking all the basic precautions that you should be doing every day of your life anyway to prevent the spread of coughs, colds, flus, everything else. What do you need to know about washing your hands? Okay, let's do a little quick episode on here. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Cover all the surfaces of your hand and rub them together until they feel dry. Now, there's a couple of things that I've heard from other people that if you're using an alcohol-based sanitizer, you may need to leave that on there for 40, 50, 60 seconds, 2 or 3 times longer than if you're just washing your hands. But always wash your hands with soap and water if it's readily available, because that is the most effective way to get it done. The next question is, should I wear a face mask? You need to follow any public health recommendations based on where you live, but as of the most recent guidelines I've seen, face masks are not recommended for the general public in the U.S. Some health facilities require people to wear a mask under certain circumstances. If you have respiratory symptoms like coughing or sneezing, then most experts recommend that you wear a mask to protect others. If you are not infected, using a mask doesn't seem to help a whole lot. But if you are contagious, or if you are infected, or if you're having symptoms, it may be very beneficial for you to use a mask to keep from spreading it to others, or at least decrease the risk of you spreading it to other people. Another question that comes up is, I'm older and I have a chronic medical condition which puts me at higher risk for getting seriously ill or even dying from COVID-19. What can I do to reduce my risk of exposure? Very similar to what we just discussed. You want to limit your exposure to where you're at. You want to make sure that if you are able to stay home and stay away from other people, you do that as much as possible. And then if you have symptoms, if you're at high risk and you have symptoms of COVID-19 or any respiratory virus, be it RSV or influenza, follow up with your healthcare provider sooner than later and make sure that you're taking every precaution that you possibly can. That way you will know firsthand that everything is going well and that you're not allowing this virus to get ahead of you. What can you do to keep your immune system strong? If you're looking for ways to boost your immune system, there's a couple of things that I can recommend for you. And this goes for not just COVID-19, but this is in general for cough, cold season, influenza season, RSV season, all of those. Number one, don't smoke. Make sure you're eating a diet that's high in fruits, vegetables, whole grains. I would encourage you to add vitamin D to your regimen. There is some very strong evidence that shows that supplemental vitamin D, especially 5,000 international units a day, may help boost your immune system. It may help decrease your exposure to viruses, or not decrease your exposure, but decrease your response to viruses and help protect you from that. You want to maintain a healthy weight, exercise regularly, control your stress levels, control your blood pressure. All of those things, get enough sleep, all of those things that we know normally that you could do to actually help improve your immune system. So just keep those things in mind and take good care of yourself each and every day, and that way you don't have to just worry about it when something comes up and you're trying to catch up. So what can we do to prepare for the COVID-19 outbreak? For peace of mind, try to plan ahead as much as possible for any outbreak. If there is an outbreak in your community, you're going to figure out that you may not be able to get to a store to get supplies. So it's important that you've got a few extra things on hand. Now, I noticed in our town recently, with all the discussion, there has been just a flurry of people acting almost in a panicked mode. I don't think that's very beneficial to anybody going on. So you want to make sure that you keep your calm and just do basic things to prepare. Talk to your family members and loved ones about how they would be cared for if someone got sick, or what you'd need to do. Sort of get an idea of what your resources are, where they're at, who can help you, those kind of things. You don't have to be fanatical about any of this stuff at this point, but you do need to at least be taking some basic precautions, okay? How do you know if you have COVID-19 or the regular flu? There's no way to know, really. The only way to really know is to be tested, but you can do this. If you assume that if you are having cough, congestion, fever, be it low grade or high grade, any other respiratory symptoms, it is worth seeking medical evaluation from your healthcare provider. And just so that you know, because it's very easy for us to test you for flu. It's very easy for us to test you for streptococcal infections in your throat. It's very easy for you to be tested for some of the other viruses. And hopefully it will soon be very easy to even test you for coronavirus. But follow up with your healthcare provider and make sure that you are seeking medical care early in the game rather than waiting until the virus has really set in and is causing problems for you. Finally, how is someone tested for COVID-19? Like I said before, we've talked about this. Hopefully in the next week we'll have better access, because a lot of the laboratories are now beginning to offer some COVID-19 testing resources for us. Prior to now, we have only been able to go through the state health departments, and you had to meet very strict criteria in order to get access to that testing. As testing becomes more readily available, then follow up with your healthcare provider and discuss with them whether or not you meet the criteria and whether or not you might need to be tested for COVID-19, influenza, strep A, or whatever is going on out there. All right. That's sort of my wrap up on the COVID-19 update for right now. As always with my videos, I want to inform you that all this context, including graphics, images, information, is for general education purposes only. If you need specific medical advice, Seek the professional advice of your healthcare professional. Don't disregard their advice. Don't delay seeking it for something you read here. So make sure that you confer with your doctor with regard to any of the information contained in this group. If you feel like you or anyone you know is sick, get that help and get it quickly, okay? And then finally, additional resources. If you, again, are not a member of our private Facebook group, I invite you to join that at facebook.com/groups/COHA40. You can also get additional information about what we're doing online at livingwellwithmikeandlisa.com. I look forward to talking with you in the next episode. Have a nice day. Stay safe. Don't panic. Educate yourself, and you will be fine throughout this epidemic. See you later. Bye-bye.